Hello, everyone, and welcome to the What's Up Downtown podcast. I'm Nate Wendt,
And I'm Jenna Sawicki.
and we are here with Kim Lemansky.
Yay, Kim!
Woo! She's the executive director for the Tri-City Health Partnership. We brought her in today to learn more about the awesome things that the Tri-City Health Partnership does and to learn more about their upcoming fundraiser. So, let's get right into it with an easy question. Kim, how you doing today?
I am fabulous. How are you?
Woo! I'm doing very well.
Nate is fired up on this Friday.
It's going to be a great Friday. It's
Good.
going to be a great Friday.
He's saying that because he gets to leave early today.
That makes a difference.
Yeah.
All right, so Kim, let's start off with, tell us a little bit about yourself, where you're from, how long have you been in the St. Charles area, family, things like that.
Okay, all the good stuff. Moved here about 3 years ago from Sycamore area. Background is all marketing, advertising, sales. Actually sold AM radio, so if you can sell that, you can sell
That's
anything.
amazing.
Yeah, AM radio.
Yeah.
That was I went out to the farmers, literally to the farmers to sell. Yeah, good times.
I didn't know about that.
Yeah.
So I bet you have some interesting stories.
Oh yeah, lots of good farm. Yeah.
Did you ever have to help with anything? Did they ever put you to work when you went out there? Or,
No,
like, were
because
you
I
in
was
heels,
usually in
like,
heels.
smucking
Yeah,
around?
yeah, I was in heels, so it kind of got me out of a lot, But yeah, so from there, I worked down in Shorewood for a while. I was the president of the chamber down there, and loved it. It was great. Got me into a whole different vibe, and from there came here, and I have 4 kids.
Okay.
My youngest is down at ISU, so go Redbirds.
Go Redbird.
And
The mayor would like to hear that.
yeah, I know. There's a lot in the building that like that. So yeah, and I've been here 3 years and the happiest I've ever been.
Oh,
That's good.
wonderful.
Yeah.
What are some things that you like to do in St. Charles?
Is it wrong to say martinis?
Everyone has their own answer.
I do. I love St. Charles.
Good.
It's fun and giving and friendly, which is surprising, I think, to a lot of people. They think St. Charles has this, that don't come here very often. So it's interesting when it really is a friendly, loving town.
Right.
That's lovely.
Yeah.
Okay.
Yep.
You mentioned what you like to do in St. Charles, but is there anything specific about downtown St. Charles that you like, or anything, any favorite restaurants or favorite haunts or anything like that?
Yeah, I really enjoy going down to like the First Street area. I
Okay.
love going down to First Street, Vintage 53. I really enjoy that
yes.
Mario will
place.
be happy to
Yeah, I
say
really
that.
do. I really do enjoy that vibe
Get a
in
rosé
there.
flight.
Yeah, exactly.
Mhm.
But I like that it's kind of got that dim lighting and it's get a little bit more of a, like a jazzy vibe
Totally.
that I really
Right.
like. And that's one of my big things too. Is I'm a big music fan. So
Yes.
love Jazz Weekend.
Yes.
Love Jazz
Yay.
Weekend. I do.
Yeah.
I really do.
Did you get a chance to get out there for that weekend?
I did.
Good.
Don't remember where I was. Sorry. It was one of the nights I went down, and it's just, again, it's all this community, and everywhere
Yeah.
you go, you know the people. And I've only been here 3 years, and I could say I have friends, and it's kind of cool.
Yeah,
you
it's
know?
kind of it's like you get that small, like a little bit of a small town mentality where you can bump into people, and it's a happy bump into, and
Yeah.
and everyone's like, welcome, glad to see you. Come sit down, pull up a chair, and let's
Yep.
let's hang out. And it's it's
Yeah.
a
I
good
joked
vibe.
over the summer with, the Wednesday wind down and all that kind of stuff
Uh-huh.
that, I'd go and I'd end up sitting by myself, but then you see everybody when they come in and you sit, and
Right.
it's a very cool vibe down here.
Yeah.
Yeah, and it's
You
that
know?
nice social experience where it's like you said, you get to see all your friends come down there, and you're like, oh, hey,
Yep.
how's it going?
Yep.
You know,
Yeah.
after a nice long day of work. So
Yeah,
I
yeah,
like
absolutely.
I like all the little kids dancing to the music. And
Yeah.
all
I
of
love
that.
Yeah.
They had a juggler. He was really cool.
yeah, Josiah, right?
Yeah, Josiah
Okay.
the juggler.
Yeah, I felt so bad because everybody was tipping the band, and so I went over and I tipped him, and he was like, "Wow, thank you." I'm like, "Well, yeah, you're doing your thing too, It was great. It was
That's
good."
sweet.
Yeah, so he'll be at Scarecrow Fest. So for anyone that wants to see him
So
again,
big
he'll
plug
be
for
there.
Josiah.
Good job. Awesome. Nice job. That's great.
All right, so let's get into the big question of the
Okay.
podcast. So, if you were Queen of St. Charles for a day, what would be your first proclamation and why?
I think my first question is, do I get a crown?
Absolutely.
Okay.
Of course, you get crowned,
Okay.
but I also think it's very interesting that your first answer to the question was with a question. So that just is very telling of who you are.
Okay, I didn't know this was a psych thing. So, no, because absolutely. When you talked about this question, I was thrilled because for me, it's an easy answer.
Okay.
I would free healthcare.
Free
healthcare
healthcare.
for a day, where everybody could get their meds, life-saving medications, and they don't have to worry about is that going to take away from food or rent? Just one day of free meds would just be awesome.
That'd be
it would
terrific.
be, yeah, it would be,
Yeah.
it'd be huge.
Yeah, that's amazing. That's very heartfelt, and that too is very telling of who you are. So
Yeah. No, and I mean, that aligns exactly with your goals. So let's talk about some of the stuff
Yeah.
that Tri-City Health Partnership does. So let's start with where are you guys located at?
We're downtown, 318 Walnut Street, and
Okay.
I've been there 18 years, and it's still funny to me how you can go in a 2-block radius and people don't know that we're there. And I always say that if you don't need free health care, you wouldn't know. You wouldn't need to look for us.
Right.
But yeah, 18 years it's been down, just 1 block off of Main, just up from Lazarus.
Okay. And how many of those 18 years have you been with the organization?
3 years next month.
Okay. Congratulations.
time flies when you're having fun.
I love my job.
That's awesome.
So, and what are the facilities like there?
It's a 2-bedroom house.
Yeah,
Okay.
you wouldn't know. I mean, it looks like a house.
It is, yeah.
a
And
very cute.
a
house.
very cute little cozy house, and we're getting ready for an expansion project. And
Okay.
we were talking as a board about, well, do we build onto the building or do we just go rent a nice or buy a space that's a more traditional?
Right.
I said, no, we need to keep this. It's really truly a part of who we are,
Mhm.
homey and warm and inviting and cozy, and it lets the patients know that this is more than just going to see the doctor. This
Yeah.
is really truly a comfort to them to be
Well,
able to walk in.
I think it's also part of the fabric of St. Charles. I think it would be hard, like especially the downtown area. I think it would be really hard to lose that,
Yeah.
and it, along with like the Lazarus House and the many nonprofits and giving back groups we have in St. Charles. I mean, we lose a piece of our fabric that we need.
I like that.
Yeah,
I'm going to have to steal that.
it's yours here.
Thank you.
Take
Yep,
it.
I will. No, and it's true because it from everything just coming up on the porch, and it just puts people in a bit of a more relaxed kind of a vibe. Going to a free clinic can be a little bit, daunting, and
Right.
it causes a little bit of stress on some people, and it's just warm and cozy, and we love it.
Yeah.
Good.
Yeah, it's really it's beautiful inside of there,
Mhm.
and you guys do it's homey, like you said. I think
Yep.
that's a perfect description, and you feel comfortable as soon as you walk in. You're
Yeah.
just like you're just like visiting someone's home, and that I think that, like you said, it alleviates a lot of any uncomfortableness that somebody might have.
I
Right.
agree. Yeah, I agree.
Yeah.
It's just it feels like home,
Mhm.
not just to the patients, but the staff. I mean, we talk about, okay, I'm going to go into the kitchen and get whatever, and it is home.
Yeah.
Right. Yeah. Especially with all the stresses around, all the being with like medical stuff and stuff like that. Having that there is
It's probably
Yeah.
it's stressful
essential.
enough.
It
yeah,
is. It is.
so,
It's
yeah.
very non-traditional, I guess.
Yeah.
Good.
So speaking of that, what kind of what kind of services do you offer in house there?
Pretty much anything that you get done at your doctor's office will do, or we can send you to a referral specialist and they can do it.
Okay.
We really have patients, it's their primary doctor, and,
Mhm.
and that's how it's viewed. So everything from, a typical dental exam to having your teeth cleaned. We can do, we do annual exams for women there. We'll do, anything you do at your doctor's office, you can get done at the clinic. We do
Yeah.
labs, we do all the cultures, we do all that, and we were able to send that out. So we can't do x-rays other than your teeth, but
Okay.
we've got that set up with the hospital, and they can go over there.
Okay,
Okay.
I'm gonna go off script here for a second, Nate.
Of course.
It's like everything you've done has been not on script. So
I'm surprised that Harry Potter hasn't been brought up yet.
not yet. No. So when you come from a background of communication background and community background, which is very much a part of this job, but now you have this whole medical part that was really brought into it. Has it been like? Are you able to kind of let your inner geek out and you're like learning so much and you're just like, this is so cool? Or has it just been like overwhelming, or what's been your experience there?
That's really cool because for me, I always say stay in my lane, and I know what I'm good at and what I'm not. And when you're dealing with the medical and the dental professionals, when I write a grant, I can do that,
Mhm.
but I have to rely on their expertise. And
Yeah.
I really do. And I'm so blessed because all the volunteers that we have, all of the doctors and the nurses and the dentists that come in, they truly give from the heart. And so I don't have to try to learn how to put in a pacemaker
Right.
because I've got the support there to do
Right.
it. So I can do the stuff that I love, which is the communications and the marketing and all that.
Yeah.
Yeah.
But just, I'm sure by osmosis, you've learned some
I
things.
have, and if I'll tell this and cut it if you need to. But one of the first
Perfect way to start a
Okay.
story.
one of the first couple of months I was there, I created a graphic of some event that we were planning, and I was so excited about it. And I took it upstairs and I showed it to our clinical director at the time. I said, "What do you think of this?" And I was still uneasy, still new at the job, and I looked at it and I said, "What do you think? Is it something that I need to change the font? What are the color?" And she goes, "No, it's great." I go, "No, just She goes, "Kim, I cure gonorrhea and you make things look good." Okay, I know my job now. So it really truly put things in perspective.
Yeah, I love that. I love that. That's very cool.
Love it.
Yeah. So, so we talked about the services, but and we can kind of go into like why are they offered? Why are they free services offered?
That's a great question. They're offered because there are so many people in the community, in the state, in the country that truly need medical and dental help, and they cannot afford it.
Okay.
They really can't. When you're talking about families that make $20,000 a year living in St. Charles, and they have 2 kids, paying for medical care is just not something that's gonna be there. And
Yeah.
right now there's no law that businesses have to provide it for these small business owners, and small business owners can't afford to offer insurance to
Yeah.
everybody.
Right.
Yeah.
And so, and with the uncertainty of the Affordable Care Act, right now we really just want to focus on those that have no other options.
Okay.
And so, for example, the poverty level right now for just one person is $12,000 a year. And because we are not a federally or state funded clinic, then we get to expend that up to whatever, the board decides. So we go up to 250%. So that same person now who he can make up to $30,000 doesn't have insurance. So he's too much money to get help, but not enough to live on and get insurance.
Right.
Ugh.
So it's that middle of the road group that we take care of.
Yeah.
Those that are in
Towing
between.
that line. Yeah.
That's right. Yep. And
Okay.
those are the people that we touch. And
Okay.
yeah.
That's wonderful. And then, can you just go into the service area, the area that you serve?
Sure. So we do pretty much from South Elgin to North Aurora. We do all the Tri-Cities, of course, and then we go out to Elburn, Wasco, Maple Park, that kind of a thing.
Right.
But what's really cool is, again, because we don't have a whole lot of people telling us anything, we get to expand that so that if someone lives in DeKalb, for example, but they work in our boundaries, they can be a patient as well.
Oh, that's great.
Okay.
Yeah.
Very cool.
Yep. And it expands. It helps a lot. We had 2,000 visits, over 2,000 in the clinic last year.
Are you kidding?
No, in
That's
that little
amazing.
Wow.
teeny tiny house.
That's amazing.
Yeah.
That's
Yeah.
really that's awesome.
So, and then how do people qualify for the services? So it's all based on the income, or what's the qualifications, I guess?
Sure. No, good. So typically it's going to be no insurance.
Okay.
Or we even do, so we have uninsured and we also have underinsured.
Okay.
Oh,
So, for example, if you might have insurance through your work, but it's a $6,000 deductible with a $300 a month payment, you're not going to be able to use it.
Mhm.
Right.
But you still meet our financial qualifications, which is that 250% threshold we talked about. They can then be patients as well. So we really do what we can to help those, because so many times they hear, I make too much money. I don't have enough to live on, but so it's really trying to help that middle of the road, the working class, the working poor.
Right. Wow. Yeah, no, that's awesome. And
Yeah.
thank you guys so much for doing that.
Thank you.
Big-
Well,
Yeah. Yeah.
No,
Round of applause to you
no,
guys.
it's not us. I
Around
mean, it's all the volunteers. We have about 100 volunteers that come in and treat patients for free.
That's
Doctors
amazing.
and dentists and cardiologists and oral surgeons that do this for free. And without them, it would not happen.
Okay.
It really wouldn't.
We've met some of your volunteers. You guys came out and helped us for the Fine Art Show,
Mhm.
and just the humblest group of people, like very successful
Mm-hmm.
doctors and individuals, and all your volunteers, and just like so humble. Just
They are.
happy to help and give back in the field that they're experts in, and yeah, that's very cool.
Well, and it's interesting because I hear all the time, Kim, thank you so much for it. I'm like, don't thank me. This is, my job. I love my job. But
Right.
it truly is those volunteers.
Yeah.
Because there would not be anyone that we could serve without.
Okay.
That's awesome.
Yeah.
And how do those volunteers, how did they get involved in the first place? What kind of, how did they learn about you
Mhm.
guys, or how did, Did you guys reach out to them and say, hey, you guys, interested in
Sure.
volunteering for this? Or
In the beginning, Dr. Gannon started the clinic in 2001,
okay,
and he was working at Kish and Delnor at the time, and he just called everybody he knew, and we've had many of the volunteers that are here now have been here since 2001.
Okay.
Oh, wow.
Yeah, I mean, seriously, there's so many that have been here, and if not, then they're friends, the nurses and stuff, those that retire. We get a lot of people that retire, but they want to still be able to serve.
right,
And, the doctors and the nurses and the dentists, they love coming to the clinic because there's no stipulation. They can spend an hour with one patient. We don't bill anybody ever. So
Okay.
they don't have to worry about checking off the right boxes for the insurance companies. They just get to go in, build a relationship, and really work with the
Probably some
patient.
freedom
awesome.
there, like for
It
them
is.
as well.
Yeah.
Yeah. Like
And
being-
they're able to get back to, their core reasoning to get into medicine in the beginning.
Exactly. So they get to feel that feel good and feel like their purpose is being met again. That's very
Exactly.
cool.
Yeah.
Yeah. And
so-
it touches so many lives.
yeah. And so if anyone is interested in volunteering, are you guys having
Always.
good?
Oh yeah, always. And that's
Talk
the thing.
him.
Please. Yeah, we'll never have a shortage of patients that need to be seen.
Right.
The biggest barrier we have is that we need to make sure that we have enough volunteers to come in so that we can bring patients.
Okay.
And we want to set the schedule up so that if if you have knee pain, we're not going to put you with a gynecologist, for example, right? So we have to be able to have enough of a pool of volunteers to make sure that we've got enough people can be seen in a timely manner.
Yeah.
Okay. And is there requirements for the volunteers? Like, for example, if someone's just getting started in the medical field, would they be able to come in and be like, hey, I need some experience. Would I be able to help you guys at all?
Absolutely.
Okay.
Yeah, no, that'd be great. The biggest thing is your license up
Yeah.
to date?
Right.
That's a big thing. But we do run quick background checks.
Right.
But other than that, it's pretty standard care for a lot of them. We've got some that are just chronic, where they'll treat the diabetic, some that'll just treat that. We've got other that are acute. We've got orthopedics that come in and do cortisone shots.
Okay.
We've got some that bring in their own medications, so we don't have to purchase that. We're truly blessed. There's no doubt about it.
Wow.
Okay.
Yeah.
So since 2001, how have you guys grown?
Okay. Grown is no doubt. I mean, since 2001, about 2008 is when the Affordable Care Act first took place.
Right.
So there was a small dip at that point, but then once people realized they couldn't afford it as much as they thought, it's gone back up again. So
Okay.
it's just been this constant marketing is a big part of it. It's so easy to get bogged down by the minutia of running the job that, we need to make sure that we're getting the word out for the patients. I coming from a sales background again with the AM radio, I don't want to say that we need to see 3,000 patients a month or a
Right.
year.
It's not like reaching quotas. Or
correct.
anything.
Yeah.
Okay.
My thing is, I just want anybody that needs help, I want them to know that we're here.
Right.
And that's really what it is. So we continue to grow. We continue to get the word out to the point sometimes that it's more than we can handle, which is, I know we're going to talk at some point about the expansion, but that's really what drove this, is that there are so many people that still need help. Even in Kane County, statistically, through the last things that we were reading, there's 500,000 people in Kane County, and doing the math, we've realized that 12% of them have no insurance.
Oh.
So just statistically, there's probably 10,000 people in Central Kane County, just the area that we serve, that don't have insurance.
Wow.
That's a huge number.
Yeah.
Right.
And these are people that are foregoing their insulin. These are people that are not taking care of anything, and their teeth are falling out, and they're not able to keep up with, and they're because they've got to feed their kids,
Right.
right? And so, going and having your teeth cleaned is definitely a luxury.
Sacrificing their health for their
Absolutely.
kids.
Yep. And
Okay.
it's easy to do.
Yeah.
It's easy to put things off.
totally.
Mhm.
Yep.
Mhm.
Yeah,
So, and then those services help people get back on that healthy track and
they do. Yeah.
offer that. Yes.
Yeah.
Themselves.
Yeah.
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 Good.
And it's important that they're able to come in and feel that they're in a safe place.
Right.
And keeping them stable is key, especially the chronic patients like diabetics. I mean, if they're not monitored and their insulin, I mean, these are people that are going to end up in the emergency room,
Right.
and that's really part of our goal. We're so blessed that Northwestern is such a huge supporter of ours, because they don't want to have somebody going into a diabetic coma and spending a week in the hospital when they can't pay for it.
Right.
So by keeping them in our clinic and healthy, we keep them out of the
Yeah. Absolutely.
Yep.
That's
And we
huge.
really do work a lot with, helping local businesses too. If you think about it, I was talking about Mario. I love going down to Mario's place. Any of the different businesses, the smaller ones, bartenders, waiters, waitresses, those are the patients that we serve.
Okay.
Yeah.
These are people that businesses can't afford to give insurance. They want
Right.
to help their staff,
Yeah.
So these are the people that we serve.
Yeah, and they're the people that keep our businesses going.
That's
you know?
right.
So,
Yeah.
absolutely.
Yep. And it truly does bring back down to economy. We will keep people working, build the economy back up.
Yeah.
Wow.
I love it. Yeah.
Big
I mean,
picture, Kim.
I'm saying.
yeah. I mean, and that's the thing. You wouldn't even think about that. Having that service offered that's
Yeah.
awesome.
We're truly blessed. I love my job.
Yeah, it's just the human experience and like how we're we gotta help each other.
That's exactly.
Right.
I like that. Yeah.
Mhm.
Yeah.
So you touched a lot about like the organization and growing, and then do you want to chat about some of your future goals that you have coming up, or kind of like where you see the clinic going? You touched a little bit on the expansion plan.
I'm so excited.
Yay!
So again, the clinic is just this little 2-bedroom house, 1 medical room and 1 dental room.
Right.
And so we just got approval from the city and from the historical commission, and we got funding. I'm so
All the
excited.
red tape you got through it.
Yep.
Woo!
So we are going to be able to, build on. So we'll have 2 medical exam rooms now, a larger lobby that will really help with privacy issues that we have in such a small space. And downstairs will be more expansion. Again, it's a 2-bedroom house in downtown. They're small, and so we'll now have a conference room where I can have more than 5 people sitting at a table, and it's huge. And the expansion is going to allow us then to treat multiple people at one time, where right now it's just one person at a time with 1 doc. So now we can literally, in a perfect world, double what we see.
That's
Terrific. That'll be.
It's huge.
great. Wow.
It's huge.
You're double your impact. That's amazing.
Yeah, it's huge.
Yeah.
It really is.
Yeah, and it's even just crazy to think, just even doubling that impact, how much of an impact that's going to have.
Yeah. I can't even.
And was that something that was on the table before you came, or is this something this is all your baby? Wow.
Yeah, you know how it is. It's a group effort. There's
I know I clapped too loud. Last time.
Committees.
I keep clapping.
committees and board. It was it was
Yeah.
definitely.
It's a group
but
effort.
It is.
Somebody had
and
to drive
yeah,
the ship.
Yeah. Well, yeah. I just want, like I said, I just want to make sure that as many people need to be seen that we can, and there's no space to do it. We need to figure that out.
Right.
I think you kind of answer this a lot or throughout everything you've answered, but what is it about the Tri-City Health Partnership that's kind of made you want to join, like become the director, and then also obviously keep going and moving forward? It sounds like it's a little bit of everything, but is there something in particular that moves you?
Yeah, the patients.
Yeah.
Coming to the clinic, again, I was down in Shorewood, and I went 5 years without health insurance. And I had to go to a free clinic in Joliet.
Okay.
And while the people were lovely, it is what you would expect from a free clinic in the Joliet area, and it just was not something that was a good time. You walk in, and it's shame. I was ashamed, and I was embarrassed, and I remember feeling like, who are you to think that you're better than these people that you can't? So
Right.
Just shortly thereafter, this position opened up, and it was perfect because I've been on the other side of the table. I know what these patients go through. I know how hard it is to walk into a free clinic,
Right.
and I know the struggles medically, and how it changes your life. It changes the way you live your life if you can't get help. So taking the position was meant to be.
Yeah, clandestine for sure.
Absolutely. Yep. Staying is easy. It's the patients, and I struggle because again, my office is downstairs. I don't get the interaction that a lot of the other staff does.
Okay.
But when I do, or when you hear the stories, there is no way that I could ever walk away.
Yeah.
Right. It's
there's-
that light that kind of fills you up, and you're
It
just
does.
like,
It
Purpose.
really is. You
Mhm.
need that. And we had one patient that we have surveys that everybody fills out, and he was saying, he doesn't speak English, and survey basically says, what do you want to say about the clinic? And he said that the clinic has saved his life, and he said that he was losing his sight from diabetes.
Okay.
And he didn't think he was going to ever get to see his grandchild grow up.
Oh.
And he said that he was feeling a lot of guilt because he couldn't work. He couldn't feed his family. Now his wife has to work. And he was truly struggling. And so when he says that the clinic saved his life, he's being
means
completely
that.
honest.
Oh my God.
right.
Yeah.
And so knowing that he now gets to be with his grandson and gets to see that, it truly fills you. It,
Yeah.
Right.
it truly fills you. And you can't help but feel nothing but grateful for what we have,
Right.
and at the same time grateful that we can help.
Yeah.
And it's so rewarding.
Yeah.
So
That's
rewarding.
amazing.
Wow.
That's an amazing story. And I know you have many more of them. I mean, that's just one.
Right.
Right.
Yeah,
That's just one.
absolutely.
So a lot of the ways that you guys are funded to help people, like the story you just told, is you guys put on fundraisers.
Mhm.
So can you touch a little bit on the big ones that you guys have?
Sure. Yeah, we really only have one big one. We do a couple little smaller ones, just
Okay.
Keep the word out about who we are. Really, is what it is.
Right.
But the next one is October 12th, so 2 weeks, and we're doing our second Casino Royale. So it's a lot of fun. We do a professional gaming company comes in, and we're going to be at the Q Center, and it really is. A huge revenue maker for us. It needs to be. We get no federal or state funding. Everything we do is grants and donations and
Right.
sponsorships, and so we really need to make these work.
Yeah.
And it's going to be a lot of fun. We've got a Breckenridge trip to Breckenridge to go.
Oh, wow.
Yeah, 5 days. Oh my gosh, it's just gorgeous. We've got dinner, open bar. But then the casino is really what it is. It's so much fun, and you just go and you have a good time. And if you don't know how to shoot craps, then you watch. And it was so much fun last year because you would see this group of people around the craps table cheering, and they're shouting the guy's name, John, hoping that he would win, because if he wins, they win. And
Yeah.
Right.
it's a lot of fun, and it's low pressure and it's low key, and you just go and have a good time.
That's
Yeah.
awesome.
It's a lot of fun.
A lot of fun. And you said, where is it again this year?
It's gonna be at the Q Center this
oh,
year.
awesome.
Okay.
Yeah. What a great
Yeah, we're
place.
excited. Yeah, it'll be
That's
good.
Really, really fun.
Yeah. And how did last year's go? Like in terms of what are some of the goals for the fundraising amounts? Things
Yeah.
like that. And so last year, let's start with how much you guys raised last year and how much you guys are looking for this year.
Okay. Yeah, last year was actually the highest revenue ever in any of the fundraisers.
Okay.
Woo.
And I know when you compare us to some of the larger groups, it's probably not going to seem a lot, but to us it was a lot of money.
Right.
We netted just over almost 45.
No,
Wow.
That's awesome.
And that's huge for us.
That's huge.
Right.
It is huge. So the goal is to beat that.
Yeah.
My net I would love to get would be 75 to 100.
Okay.
But that's going to really depend on getting more people there. So they
Okay.
need to go and have a good time and help support their neighbors, and that's what it is.
Yeah.
And
Great.
for that $45,000, like I see the statistics every time where it's like, $1,000 can help feed
Yep.
8 families. So how does that kind of work with like $1,000 can provide medical to like
You got it. Yeah. Well, I can tell you that on average, one office visit, our cost is about $204
Okay.
for one office visit. Insulin for us, our cost for a 3-month supply for one person is $1,200,
Okay.
and that's our cost. So that's a lot of money. An asthma inhaler is $90.
Yeah.
So when you put all that together, our overhead monthly is $30.
Okay.
So that took care of just more than a month and a half of
That's
us being
wonderful.
open.
Yeah.
Right. And
I mean-
100,000 would get you guys through a whole quarter of the year.
I can't even imagine.
I
can't even
Let's
imagine.
get you there.
Yeah, exactly. Let's do it. Come on.
Yeah,
And
any of
it's
you
fun.
listeners out there that have some
Yeah. Even
extra
if you
savings.
can't make it,
Yeah.
I mean, this is such a worthy and amazing organization. Just
Yeah. And I appreciate that. Yeah, and it really is. It's funny. People don't realize that, the patients that we serve are their neighbors. These are the bartenders, the waitresses. We have clergy that are
yeah,
patients.
I didn't think about that.
Okay.
Yeah, absolutely.
I mean, these are people that sit in the church pew next to
a
you.
lot
These
of
are
nonprofit workers. Yeah.
Mhm.
exactly. These aren't. Yes, we do serve Lazarus happily,
Mm-hmm.
but that's not the bulk of who our patients are. These are the working poor that are in the neighborhood.
Yeah.
Okay.
How can people find out information about the Casino Royale event, and how can they buy tickets and all that kind of stuff?
Easy. Call me or go to the website tchpfreeclinic.com. .org. And there's quick, easy links there. Ticket prices are, there's no extra in the ticket price. We really tried to keep it as much as we could. And because I love the Business Alliance, that anybody that is hearing this and wants to purchase tickets, if they use the code Business Alliance, one word,
What's
they
our first code, Nate?
I'm so excited,
That's
Camera.
right. There you go.
We have a
you
code.
if you put the discount code Business Alliance, one word, in the little promo code area, you'll get 10% off your tickets.
Yay, thank you for that.
You're
And
welcome.
our
Awesome.
listeners, please go out and please support because this is a very
Yes.
worthy event.
You
And
know,
it's fun. That's what it
And
gets.
it's
Yeah.
fun.
It's fun.
Yeah, if you want to see change in your community, this is a great place to start.
Awesome. Stealing that one too.
Yeah, it's like, write them all down.
That's right.
I think that might be the title of the podcast episode.
Yeah.
Awesome.
That's great. Yeah. And then you mentioned the website, but is where else can people find out more just about the Tri-City Health Partnership?
Facebook, you
Yeah.
know, I mean, that's always an easy place to go.
Okay.
And, you know, call the Business Alliance, call the chambers, call around. You know, people know us. They just don't know that they do,
Mm-hmm.
you know, and call me. You know, I am happy to give tours. I tell
Kim
everybody.
works all the time.
It's a big
Yeah,
girl
she's
job.
always she's always working.
It's a big girl job, you know, and
Yeah.
as you know, it's
Yeah,
just you
it's
do what you
always-
have to
you're
do.
on- you're on
Yep.
call.
And I always say, you know, when you love what you do, it's easy.
I agree.
Okay.
Yeah.
And just want to talk just a little bit more about the Casino Royale.
Mm-hmm.
So besides the, you guys have poker. We got what's some of the activities that you guys have there?
Yeah. So there's roulette, there's poker, blackjack, craps table, and we've got some slot machines.
Okay.
We're gonna have close-up hand magician will walk around,
Ooh.
and he's so much fun. He does the
Fancy.
arcada upstairs. Have you guys ever seen him?
Yes, I have.
I have
but
heard
that is
of
also
him.
a good segue. She's brought up magic. That was on her own. So I'm just
No,
kidding.
we're
Go
not
ahead.
connecting that to Harry Potter, Jenna. No,
She did it.
we've gone 4 episodes
You
without a
are-
Harry Potter reference.
I don't know how. Go ahead. Keep
I don't
going.
either because we are the wizard in the town. Of
There you go.
No, yeah. So it's going to be great, and it's really going to be set up so that it's just that's the entertainment portion of the night.
Right.
You know, you're just going to go. We have dinner, open bar, right? We'll do, some live auctions that are
Okay.
incredible. We've got some great live auction items this
Yeah,
year.
you talked about the Breckenridge. What are some other items
We've
that'll
got
be up
two
there?
2 Mexico trips.
Okay.
One is all inclusive. We
Awesome.
have tickets to Medina Golf Course if any golfers are listening.
Okay.
We've got
awesome.
Blackhawks tickets. We've got, I mean, it's
Ooh.
going to be great. We've got, it's going to be a lot of fun. And then and what you do then is if you go and you're having a good time and you're gambling, when you have chips left over, the chips then you can use to buy raffle tickets for all the great raffles that we have.
That's awesome.
So it's just going to be a good time. And it really is just, go have fun. Celebrate.
Yeah.
Celebrate.
Awesome.
Yeah.
Well, that's all the questions we got. Is there anything that you'd like to add or say about the TCHP or anything?
Oh,
or
I
the
could keep
Real?
going, but no, we're just blessed. We really are. My big thing is just let people know we're here. Help me spread the word. I believe that the money will come. We need it, but the focus really is on anybody that needs help to know that we're here.
Yeah.
Well, the community is very lucky to have you. We're very lucky to have you. Thank you very much for
Thank you
coming in
guys.
today.
I
Yeah.
appreciate this. Thank you.
Yeah,
Thank you.
it's so
Thank you.
fun.
Yeah. So, and thank you to all of our listeners for listening, and to Kim again for coming in
And
today.
for giving us for our first code.
Yes. Woo! We had so much fun, and
Awesome.
we hope you did too.
I did. This is great.
Yeah.
We're doing
So-
it next week, right?
Yes. We'll see you next week. Okay.
So that's all we have for the podcast today. So we will catch you next time on What's Up.
Downtown.